The CONPET was published last year. It was a study of 150 patients after transplant that were in at least VGPR. The intention was is that we know that those at that stage after transplant, if they still have positive PET, their survival is worse. That's from a French study some years ago published by Philippe Moreau. So it used that population and gave them more treatment. So of the 150 people in VGPR that we screened after transplant, 100 were PET negative, but 50 were PET positive. Those 50 were treated with 4 consolidation cycles of Carfilzomib and Lenalidomide and Dexamethasone. And the endpoint was how many then became PET negative after this. Also the MRD bone marrow sampling. So what we saw was that this was published last year in leukemia, that 1/3 of the patients did become PET negative, and they were more likely to do that if they also were MRD negative at inclusion. What we're presenting now is follow-up data, and what we're looking at now is what happens with PFS and OS in the 2 cohorts, because then you have, it's not a randomized trial, but you have 50 patients that are PET positive with a bad prognosis, 100 PET negative with a good prognosis. And we gave the PET positive more treatment. So now we have compared those 2 groups for PFS and OS. OS is still early, but the PFS looks extremely similar. So it's not a randomized trial, but it's an indication that by giving more intensive treatment after transplant to patients with a PET positivity, you could make their prognosis more similar to the PET negatives. So that's sort of the major result of the thing we're presenting here this year.